Advisory Board and Managing Trustee of Eye Bank Coordination and Research Center in Mumbai, popularly known as EBCRC, which is among the leading eye banks in the country and till date have provided more than 11,000 viable corneas for transplant for corneal blind people. Several editions of his book Eye Donation and Eye Banking in India have been published in English and other regional language. We are in conversation with Mr. Jashwant Mehta, who has always led from the front with the spirit of never giving up, a torchbearer and a
most transparent layer of the eye. And the light enters the eye through the cornea just like the lens of the camera. Now, if due to any accidental injury or any serious infection, etc., which cannot be retrieved after the death, the endothelium cell in the cornea remains live up to 6 hours after death. In a reasonable time frame of say 10 years, we need to perform at least 100,000 corneal transplants a year. As against this, prior to pandemic, which had affected
at the required pace.
To begin with, we must understand and recognize that basic parameters of eye donation and corneal transplant are vastly different as compared to other organs. Now, as I have mentioned to you earlier, all these other organs, liver, kidney, and heart, cannot be retrieved after the death, whereas cornea are retrieved after the death up to 6 hours after the death. Secondly, the blood group between the donor and donee has to match for successful transplant of other organs, whereas this is not at all necessary in case of corneal transplant. Thirdly, remove heart, liver or kidney from the donor is a full-fledged surgery, whereas to retrieval of cornea is a much simpler process, and even a trained technician with a few weeks training can easily perform this, and it doesn't require any medical degree. Fourthly, there have been a lot of stories of scams and scandal in case of other organs, whereas this is not the case in case of cornea because they are retrieved after the death. And fifthly, in case of medico-legal cases where postmortem is required to be performed, the retrieval of cornea doesn't affect the postmortem findings and it doesn't even disfigure the face of the disease, whereas this is not at all possible in case of other organs. Now, to exploit these favorable points as regards the corneal transplant, unfortunately our lawmakers have never failed to take a note of this, and this has seriously affected our progress.
To support this, can you give us some comparative statistics about the impact of favorable legislation between India and other countries?
We started eye donation activity in mid-50s. Now, considering the span of 67 years, our progress has been really slow, looking to the statistics. Now, the countries which have separated cornea from other organs and have a favorable legislation, the progress has been much faster. To give you some comparative statistics, between 1961 and 71, in a total period of 10 years, USA had only performed 20,000 corneal transplants. From mid-70s onwards, most of the states there passed the favorable legislation, and the impact was very obvious. The number of eye donations, which were a mere 6,000, touched a figure of 36,000 in 1988. And today, apart from performing 50,000 corneal transplants and eradicating corneal blindness, the USA is in a position to send corneas to several other countries where there is an acute need. Last year, that is just prior to the pandemic, they had sent 20,000 good quality viable corneas to other countries where there has been acute shortage.
Presently, we have Transplant of All Human Organs Act, known as THOTA, which covers transplant of all human organs, including cornea. Mr. Mehta, can you share some more insights on this act?
When in 1994, THOTA was being enacted, we had even prepared a model corneal grafting act, separating cornea from other organs and submitted it to the parliament. But unfortunately, this was never paid any due attention. All along, by having cornea clubbed with other organs, it has really hampered our progress. Till 2012, it was mandatory to have a registered medical practitioner only to enucleate cornea. This was a major obstacle because in case of large number of home deaths where cornea was to be retrieved, it was a very difficult exercise to have a medical practitioner we will spare 2 to 3 hours from the active practice to go to the home of the disease to retrieve the cornea. After all our persistent efforts, in 2012, HOTA was amended and it permitted the trained technician to enucleate the cornea. And for this, we are grateful to late Desiraju, then Health Secretary, Government of India, who took lot of pains. Now, except for this, the cornea is still clubbed with other organs, and we have no provision for required request and presumed consent. These two provisions have helped several countries to achieve a much faster progress. In case of required request, as per the provision, it is mandatory to request for eye donation in case of every death. And it has been found that if the request is made, even with little motivation, in at least 10% of the cases, the relatives, the next of the kin doesn't mind permitting the eye donation. Now in Bombay alone, there are 70,000 to 80,000 deaths taking place every year. Even if we are able to retrieve 10% corneas out of this, it will come to 7,000 to 8,000 as against our present number of 1,500 to 2,000 eye donations every year. Now, as far as provision of presumed consent is concerned, it permits removal of cornea unless there is a pre-recorded objection in all medico-legal cases where post-mortem is to be performed. In Bombay alone, we have more than 7,000 postmortems performed every year. Even if we are able to retrieve 30 to 40% corneas out of this, the number will be 3 to 4,000, and this will be good quality corneas as compared to the corneas retrieved from the old age patients, as most of them are from younger age group. With both these provisions, the USA and several other countries have progressed much faster. In fact, from the information I have gathered, in USA, in some of the states, these provisions are so strictly enforced that if they are not complied with, there is even a stringent provision of suspending of the license of the hospital.
So, Mr. Mehta, before summing up, we would like to know the future line of action.
Well, for and on behalf of Eye Bank Association of India, all along we have been representing to the Health Ministry and Law Ministry to have a separate, favorable, proactive legislation for corneal transplant and eye donation. We have even written to our Honorable Prime Minister Narendra Modi in this regard, and we hope sooner it is enacted, better it is in the interest of the country, as it will not only help us to eradicate corneal blindness in the soonest possible time, but will also make India a world leader by having surplus corneas which could be sent to other countries to help other countries where there is an acute need, such as Bangladesh, Malaysia, and several other African countries where there is a huge long list of corneally blind patients waiting to get a good quality cornea to get back their vision.
Padma Shri Dr. Gulapalli Rao is the founder chair of LV Prasad Eye Institute, which is among the premier eye institutes in India. He is the recipient of several national and international awards. He has received 5 honorary doctorates from Australia, UK and India. He is also the founder member and former president of
becomes opaque. Corneal transplantation is the only way to restore sight. For this to occur, we need a healthy donor corneal tissue. Donor corneal tissue of good quality is made available only by the creation of a vibrant corneal eye banking system. One of the major requirements for this is that will then enable corneal transplantation across our country. Its efforts are indeed laudable. The final outcome, I'm sure, will be a successful one that will then make India a leader in the field of eye banking and corneal transplantation in the world.
Of corneal donation exponentially. We reiterate that we must delink the corneal donation laws from those of other tissues because the requirements are totally different. Therefore, progressive laws need to be initiated, like the required request and the presumed consent laws, which are available in other countries, progressive countries. This will really help the movement. donation and corneal grafting surgery.
It is indeed important to separate.
I think we. Yeah.
Very, very nice. And just wanted to raise a point. I think the law in nothing will work unless it is made a law. It
Yeah.
can't be a plea. It has to be a law and a legislation. So just like the ways you said, like retrieval of corneas by eye bank technician, the way we move forward for that, cornea should be treated as a national resource. It can't be like independent. So there should be no state action in that. There should be a legislation for retrieval, and this should be very uniform all across the country. That is the only way, because there's no reason for India to say like we are lacking corneas. We can,
Yeah.
the way the people are motivated, driven, and the way things are. I think I fully agree to your video and
Yeah.
points.
In 2008, we had this law, registered medical practitioner could initiate. They went backwards and defined registered medical practitioners only those with allopathy degrees. We were managing eye donation through our eye donation centers by way of, because it was difficult to get an allopathy doctor. We had a panel, Ayurveda doctors who were motivated. Even dentists were motivated because they are registered medical practitioners. And all of a sudden, rather than going forward, they brought a law that only an allopathy. And that was like almost a death knell. Bombay, we are almost on the verge of closing down eye banking. It was just next to impossible. And that was that point of darkness, whatever you may say. We received a so-called notice. Some of your eye donation centers are getting it done through Ayurveda doctor. We have proof. And they demanded huge sum of money for violating, because the violation of HOTA can imprison the person. That was so bad. And that was that point of time we rushed to Delhi. We came in contact with Desi Raju, and at least was kind enough to have a trained technician cadre. And even for that required request, he was helpful by sending instructions to all the states. In that medical course for that certificate, at least you should have a column for eye donation. In Bombay and Maharashtra, at least it has been enforced through a court order. But even the court order, unless there is a law back with the court order, things don't work out so smoothly.
Thank you, sir. And actually, the way forward is to make the roadmap regarding this change of legislation. We move forward now, and we have our next speaker, Dr. Hitendra Ahuja, and he will be talking about creating awareness amongst masses, innovative approach. Yeah, that's what I was telling. No, no, in Delhi it is very much valid. That I can assure you.
So,
No, you
yeah,
can show
no,
picture
Rajesh,
and with
no,
MOU.
Rajesh
Yeah.
is right, because health is a state subject.
Yeah, yeah, that
So,
is-
though there's a central law, each state has to adapt the law.
Yeah.
However, except for one or two states, like maybe Maharashtra and Punjab, most other states have accepted it in toto. But this is the other problem. People are taking their random decisions. Different people are going for inspections, and they're leaving it to the discretion of individual inspection teams what they are doing. And some places they're delaying it for 3 years. Fortunately, in Delhi, they have been very receptive to everything we have said. So the Delhi government is very prompt, and we make sure that before any transplantation center or eye bank permission expires, we go before, and now we also say up interim extension de do. I mean, like for example, I had to go to Pondicherry, and there was because of the COVID, it was difficult. I said just give them extension for 3 months. Because there's no point stopping the work.
Yeah.
And unfortunately, this is a legal thing now. We were never having this problem earlier. And but the government also realizes, and we can look at some shortcuts and some long plans. The shortcut is to immediately put a representation for amendment of these 1 or 2 points in the rules, which are not at all a problem. We just have to say that corneal transplant center specular should not be mandatory, and if there is a MOU for an eye bank with access to an eye bank specular, because after all, we are the corneal surgeons, we have to say that it's not necessary. What will the babu know what a specular does, etc.
Yeah.
So we only are the ones who put that requirement there. So we only have to remove it. They won't mind. And the third thing we should do is that this surgeon point. The surgeon point is also valid. That also we can say that there is a shortage. And corneal transplantation is not that you're so busy for 6-7 hours operating. You can usually do one patient in one center and the other one in the other center.
Yeah.
And the third thing, the ministry has been getting some requests from other places also, because they are saying that the penalties are too high. Even other tissues like bone, skin, they are saying that people are going to get imprisoned for small things. So they are also representing that for tissues the penalties are too high, so they are willing to consider a different chapter. So if we start changing the law, it's going to be another 10 years journey. And honestly, whatever we say, the parliamentarians have a different view. For example, they refuse to allow the word research. If you remember earlier, the law only said therapeutic use only, and it was only after repeatedly telling them that eye banks are not able to use each and every tissue. Some tissues we have to discard, so you have to keep some provision, because otherwise tomorrow some troublemaker will come and put an eye banker in jail कि ये दो tissue आपने क्यों discard किए. So then they agreed for medically suitable corneas for medical education and training. They still did not agree for research, and many eye banks are not aware of this. They're using the word research in their consent form. You see, because people are just blindly following America, but this is not America, no, this is India. So I think these 3-4 points we can immediately take care. Plus, we should have this journey for amending the law, separating it, but different chapter. Yeah, and whatever these 4 points, and like for example, sir, you said required request. So they have required request only for ICU, because they are only organ centric. They want only ICU because then they get liver, kidney, and heart. But at least it is there. So eye banks may not be aware that required request is mandatory in ICU deaths. And in a way, if you really see, if you have a required request for every death which is happening in every corner of India, will you be able to go and collect it?
It won't happen.
Supposing it will happen in like...
Only what we can do is at least where there are eye donation centers, the require request. The law can be like that. If there is a eye bank within a periphery of certain area, the require request law has to be implemented. That is a simple thing. First, let us
ICUs, but we can say that extend it to hospitals which are near an eye donation center.
Yeah.
That can be done. So these 4-5 points can be done in no time, but separating will take a long journey. But chapter, yes, is possible. We should keep parallel. Like we should have these 3 things going in parallel, because we should not stop.
Radhika, in our own mindset, we should not say it is going to be difficult. Otherwise, it is like always.
No, sir, it's
We
not
have,
a question
in
of
fact, we have ophthalmologists who are members of Rajya Sabha.
But sir, they don't care.
They don't care, unfortunately.
They don't care. And I'm just being realistic.
Very, very
We
correct.
should do it, but we should be prepared for a like we have to, when you know something is difficult, to prepare in that way. So we should do it
True.
that way. And it can be done.
Yes, Dr.
Yes,
Ethan.
ma'am.